this neurological system, like you say, I've never seen it before in practice, especially the last 4 years of, the dysfunction of the autonomic nervous system and the limbic system. So maybe let's define that triad or that trifecta that causes a lot of these symptoms and which results, we had Tanya Dempsey on the show talk about mast cell activation. We've had Patrick Porter, David Rabin talk about the nervous system and vagal tone. But maybe define the limbic system, vagal tone, or the autonomic nervous system, how they work, and then the mast cell system that is often the downstream effect.
Sure. And and you are pointing out, and I want to emphasize that the trifecta of sensitivity, the three things that combined most commonly to create sensitivity are a dysfunctional limbic system, vagal system, and mast cell activation. And these are not separate. These are totally interwoven, both from a biochemical, cellular, and neurological process. Each affects the other. So it's also important to understand that once these systems are not functioning properly, you usually have to work on all three to get better. If you just work on one, you're going to have a hypervigilant system. If we quiet the limbic system, but we're not working on the vagal mast cell system, you're going to still be hypervigilant. So it's a combination. All three need to be worked on. The limbic system is the part of the brain that primarily is responsible for two main experiences for us: emotion and sensitivity. So if someone is wondering, is my limbic system messed up? Do I need some help with it? If you have any emotional issues, and that can be anxiety, depression, mood swings, OCD, depersonalization, derealization, any of those things are by definition limbic. So if you didn't used to have that, and you now have that, and it came out of the blue, this means your limbic system has been impacted by the conditions that trigger all of this. The other piece to that is sensitivity. If any person tells me that they've become increasingly sensitive to light, sound, touch, chemicals, EMFs, food, that's also limbic. So with either or both, usually both, an increase in emotional reactivity and sensitivity, it is literally your limbic system is announcing, I need some help. The vagus system, and I want to emphasize it's a system, the vagus nerve itself is just the 10th cranial nerve. But it works in concert, coming out of the brainstem with a whole bunch of other cranial nerves. So although the vagus nerve has gotten the premier attention we name it, it's really a vagal nerve system in which other cranial nerves are involved as well. And the vagus nerve is, number one, a major cornerstone of the autonomic nervous system. So when people have temperature dysregulation, intestinal issues of every type, because the vagus nerve supplies the intestine almost all the way through, it controls intestinal motility. So if someone has bloating, gas, distension, reflux, constipation, diarrhea, abdominal pain, likely there's a vagal piece to that. And then palpitations is a common symptom that the vagus nerve is unhappy. So other symptoms tell us that the vagus is involved also. And honestly, the vagus and the limbic system are so intertwined that it's almost impossible to have purely limbic issues and not vagal issues, and vice versa. So and I want to emphasize that both of those systems are protective in nature. They're not trying to hurt you. They're not trying to make you miserable by giving you these symptoms. They're trying to wake you up to the fact that they don't think you're safe. And the symptoms are to alert you to be attentive to what's in your environment so you can be safer. And again, this is not psychological. This is neurological. So if we're going to fix it, we literally have to reboot the nervous system. And here's the good news. We can.